to meet halfway. Whatever I know and whatever you know, let's work it out together. What's virus? Airdrop? Airdrop? Airdrop. So the airdrop, like that? Droplet? Airdrop. How about you, darling?
What's the question?
What do you know about coronavirus?
It's like a respiratory infection.
Respiratory infection, like?
Pneumonia.
Why can it cause pneumonia? Okay, very good. How about you? Nothing. Okay. So the coronavirus usually attacks the respiratory system, right? If I have to give a little pathophysiology of the respiratory, it goes this way. Air from outside. Is that inhalation, right? Air comes in. Positive, negative, air comes in. Did you get it? So it goes from the nose, pharynx, larynx, trachea, bronchi, bronchioles, and the very important lungs. Did you get me? So if I am the air, I will go nose, pharynx, larynx, trachea, bronchi. It's so straight, right? So when you inhale, I don't even see anybody like inhale like that, because positive, negative, it draws. Did you get my point? Okay, that is what you call the internal respiration or the external respite. In short, oxygen is here from the nose to the pharynx to the larynx. Is this important? Yes. Right? You have to know this. Because what if a family comes over? My father has corona. What is that? Oh, it's a virus. What's virus? It's corona. I explain. You know what I mean? Right? And then you call the doctor. Doctor, patient. Okay. A chest x-ray, whatever. Okay, right? You're the nurse. You're the frontliners. We are the nurses. We should know it better. So when a family comes in, oh, you know, sir, this is how it is. From the nose to the pharynx to the larynx to the trachea. See? Oh, so you're very good, right? So from the nose to the pharynx to the larynx, trachea, bronchi, bronchioles, alveoli, oxygen, gas exchange. Did you get my point? Okay. So oxygen comes in, carbon dioxide goes out. Did you get it? That is what you call external or expiration. So you in oxygen, expire oxygen. Good? Did you get it? Good? Are you with me? Do you understand?
Yes.
Okay, this is just a physiology. I would include the patho later. Did you get it? So the oxygen here will involve getting out, going into the heart. Right? Pulmonary vein to the heart, to the body. Did you get me? So that is oxygen. Good? Okay, so oxygen goes to the brain. Oxygen will go sa baba and everything. Everything. I'm sorry. I'm sorry. Okay? Oh. Did you get my point? Okay. Now let's go to corona. Simply, I cannot explain the whole process of respiration. It will take us 3 days. You want 3 days? 72 hours? Of course not. So at least you know the physio, right? So when a patient says, I have asthma. Okay? Nose, pharynx, bronchi. Asthma. Bronchioles, bronchitis. Alveoli, emphysema. So those are the parts that is affected. That's the reason why the patient is wheezing, because affected is the bronchi. Right? Do you see? Yeah? Are you with me? That's fine? Okay, cool. Did you get it? Okay, cool. Okay. Any question? Any further question? Any violent reaction? Binili ko pa to, ah. This is $39. Not being paid. Cash. Okay. So this is the virus. Where did the virus came from? Of course, from somebody. Am I right? So for example, cat has the virus, and then I'm talking to her. She doesn't know that she has the virus, because she will only know that after 14 days. So I got the virus, and then I talked to these people, they have all the viruses. That is how it is transferred. That is the reason why you are advised to stay at home. Did you get me? Instead of trying to put all those, at least at one people only or at one person. Did you get my point? Okay, cool. So this is the virus. It travels into the nose, pharynx, larynx, trachea, bronchi, bronchioles, alveoli. Good? Okay. As I have to go back to the physio, there are two kinds of important cells in the alveoli. Two kinds. Dalawa. Two kinds. Are you with me? Good. What are these two cells? Going back to physio. Number one is ciliated cells. Ciliated, these are the wavy type, right? And very good goblet cells. These are all in the lungs. Good. What is the action of the ciliated? They are the wavy branches that push out the bacteria out, right? And what is the action of the goblet? It produces mucus. Once bacteria sets in, you do cough. And you good? So, are you telling me then that cough is a compensatory mechanism? Yes. It is defensive. Could you imagine if you don't cough? All the bacteria is there. Are you with me? So once bacteria comes in, goblet cell stimulated, mucus form. Okay, are you with me? Good? Are you with me? Okay. If goblet is the one that is affected, you will have wet cough. Wet. So when the patient says, I have productive cough. And then you would ask, what productive? How is it? How would you know if it's productive? How about you? How would you know if it's productive? Oh, when the patient cough, oh, that's productive. There's phlegm. There's phlegm. Are you with me? But when the patient cough, oh, that's dry. Nothing to speed up. Are you with me? Okay. Now, corona virus will not attach to the goblet cells. It will attach to the ciliated cells. Again, if I am the virus, this is the goblet, this is the cilia, I will not attach to the goblet, I will attach to the cilia. Did you get my point? This is mucus, this is cilia. So it's dry cough. That's the reason why it is dry cough. So when the patient said, I cough very hard, it's the cilia. I have a wet cough, it's the mucus. Cool? Are you with me? Okay. So if this is the virus, it attacks to the goblet or to the cilia. Good. Wet or dry? Okay? So the virus is here and he's swimming in the cilia. Got? Okay. The problem is, if you have the virus, he's not only the virus. It's not only one. He tries to replicate and do copies of it. So, not only one virus, but many viruses. Did you get it? It's not the real one. It's not the real virus. Are you with me? Okay. Somebody asked me this morning, but we need bacteria in our body. You're right. You are right. But when bacteria of E. coli from here goes here, it's not right. Because this is where E. coli stay. This is where strep stay. Streptococcal, right? Oh, but if streptococcus goes there, something must be wrong. Did you get it? Oh, I saw streptococcal in the vagina. Why? It came from here, it went there. Something must be wrong. Are you with me? Oh, I take E. coli from here, went there. Why? Oh, right? Because this is, I'm just trying to be real. Are you with me? So when the doctor said, why is the E. coli from here went here? And why is the strength from here went there. Oh, is that something not right? It's not. So, if collar should stay there, strap should stay there. Did you get my point? Are you with me? Why? Okay. So once it attacks to the cilia, do they replicate? Do they make copies? Do the virus just created lots of sons and daughters? Right? Okay. So far so good? Good. So what is affected? The lungs or the brain? Very good. Alveoli? Airway? Very good. Can I erase this now? Okay. So far? So far? Okay. Somebody asked me, what is affected? There are two systems that is affected. One is the respiratory, number two is the immune system. Who knows anything about the immune system? So pag tinanong ka, what is immune system? It's the system of the immune. Right? Oh, what if somebody asks you about that? What if somebody asks you about that? What is the immune system? Can you explain? No, understand. Just wanted to make you laugh. Are you enjoying it? Yeah. I'm shifting gears. I'm going to stay here to do lectures. Look at me. What's this? This is the bone marrow. Bone marrow is found here, sternum, here, and at the back. So when I am hit like accident and this is broken, I will have a problem with my bone marrow. Oh, they just wanted to smile together. I know, right? Oh. 1 meter apart. 6 feet, 1, 2, 3, 4, 5, 6. Okay. So the bone marrow. Bone marrow, 1, 2, 3. Tama? Okay. Are you with me? Is this the immune system? Immune system ba ito? Yes or yes? Anong pinaform ito? This is what you call the stem cell. Nag-form siya ng what? WBC, platelet, and erythrocytes, or the RBC. Again, ulitin ko. The bone marrow produces the B lymphocytes and the T lymphocytes. Are you with me? So it forms the RBC, WBC, and platelet. Got? So if the patient has bleeding, is that platelet? RBC, siyempre. Yes, platelet. Platelet, na bleeding, platelet. Oh, when the patient is bleeding. Okay, check RBC. Di ba? Sinasabi ng doktor? Right? Yeah, sinasabi ng doktor. Check the blood. Oh, the doctor said. Okay. Is the patient, doctor, the patient is having warfarin. Check platelet. Cool? Okay. So that is the B lymphocyte. You got it? Humerus bone. So when the patient has anemia, it is here, RBC. When the patient has infection, it is here, WBC. If the patient is taking warfarin, it's here, platelet. Kuha po. Kuha. Okay. And this is also the one that is producing, B cells. They are the one that produces the B cells. Okay. What is the B cells? The B cells is called the memory cells. O syempre, you don't know that. I presume. $1,000. What is B cells? Malamang, isa. B cells. An antigen like her came into me. Oh, huh? Antigen? Antigen. Foreign body. He went inside my body. Antigen, antigen, just the same. Right? So, is that a foreign body? Okay, there is what you call the antigen-antibody reaction. It will produce inflammation. Very good example, measles. If you have measles once, do you have another measles? No. If you have chicken pox once, do you have another chicken pox? No. Why? If it is the antigen, it goes inside, my antibody will read it. Oh my God, this is measles. So the next time that antigen comes in, he already recognizes it because he created a memory. That's the reason why you don't have the measles anymore. Kuha? Ay, kuha. Yes? So what cover? Okay. So what does B cells produce? Memory cells and effector cells, right? Okay. Is this where the WBC is? RBC and so on and so on, right? Okay. The T cell, B cell, T cell. Okay. This is the T cells. This is where coronavirus attacks. I don't care about the B. I care about the T. It's on the immune system. And the T cell is divided into two. T helper cells, right? And the cytokines. Are you with me? Cytokines. So I am corona. Where do I attach? B or T? T. Cytokines, right? Where do I attach? Cytokines. So if I am corona, I go to cytokines and attach. Did you get my point? And then cytokines would say, oh my God, this is enemy, and produce more and more. So that is what you call cytokine storm. So there are lots of coronavirus over. Did you get it? It depress the normal cells, and there is more coronavirus. Did you get it? Good? Okay. What did it affect? B cells or T cells? T. Cytokines? Cytokines, yes. It affects the cytokines, right? So when they would ask you, those who are taking the NLS, they would ask you, what cell is being affected by the coronavirus? B or T? T. Is this the cytokines? Yes. Cytokines, yes. So this is my cytokine and corona attached. Right? Another corona attached. Another corona attached. So it is what you call cytokine storm. Good? Okay. Cytokine storm produces more inflammation. More inflammation, more inflammation, more inflammation. That's the reason why the second symptom is fever. Because of the inflammation. Right? First is dry cough. Because of the affection of that. What? Very good. Did you get it? And the second is the fever because of the inflammation. Good? Okay. So if it is inflamed, this is the blood vessels is inflamed, does it get bigger? Of course. When it gets bigger, nowhere to go. That's the reason why fluid goes out of the blood vessel. It goes into the lungs. And that is the end of your life. So once you come into the patient and say, how are you? And she said, acute respiratory distress syndrome. Did you get it? Mainly because the fluid from the blood vessels get out of the lungs, it flooded the lungs, and the patient complains of difficulty of breathing. Did you get my point? So when you go to your patient, here's fever. I may corona. She might not be taking a bath. Right? Oh, don't you just say, corona, sent out. Oh, crazy. Are you with me? Okay, so again, T cells is being attacked. Corona attached to cytokines. It produces cytokine storm. It creates inflammation. The more it inflames, the more water seeps out of the blood vessel. It goes out of the lungs, and the patient will complain of shortness of breath. Kuha, and then the patient will have flooding, right? Fluid pulmonary edema. That's the reason, and pneumonia, of course. That's the reason why the patient dies. They don't die of the corona, they die of the complication. Did you get it? Kuha? Oh, any question about corona? Did you understand? Did you understand, darling? Where's the corona usually? B or T? Very good. Does it produce more corona? Yeah. Right. That's the only issue we have. Producing lots of corona. It's an immature. Okay, now, somebody asked me this morning, when will I send the patient home or stay at home or send to the hospital? There is what you call triads, right? Triads, triage, whatever. Okay? Okay. Number one. Okay, we're done. Do this. Okay, number one. Triads one. Do you know Alma? Madriada? Yeah. Okay. Alma came from the Philippines, right? Now he comes over here. Alma is 30 years old. He's less than 60. He came from the Philippines. There is coronavirus over there. So he might or she might be exposed to corona. Are you with me? So positive exposure. But Alma has no symptoms. Okay? So Alma called me yesterday. Can I come into work? No. You are considered PUM. PUM means person under monitoring for 14 days. Why? Incubation period of corona is 5 to 7 to 14. Good? Why? I don't have any symptom. That's the reason why we are monitoring you. After 14 days, you can come back. The bad thing is, after 14 days, that's where the symptoms came out. Which is very unusual. Because the incubation period is 5 to 7 to 14. Did you get me? Okay. How about if I am less than 60 years old? I have one symptom like fever. Okay, but I am not 60 years old. Are you with me? Okay. Can I go to the hospital? No. And have my exam. I have fever. I'm trying to sit. No, stay. You are considered PUI or person under isolation. So if I am at home and I have fever and I am 26 years old, I would tell my kids, stay away from me. I will be alone in the room. Don't ever try to touch me. Okay? And every time you come inside me, wear all those gowns and everything. So it's one specific person will take care of me. Did you get it? So in, right? Okay, the PPE. Are you with me? PPE out, PPE in. Okay, now let me ask you, what is PPE?
Protective.
I know. What is the first thing that you have to wear? See? I know. Ask somebody. How about you? You know it? Mask?
It's the headgear, right? Because
$100. $20. Promise. Oh, okay. Gloves? Really?
Washing first.
And then?
Yeah. Then you.
See? I'm washing first. Everything follows. Right? Okay. It's just very important. Yeah. If I am the state, I would go to you. Are you using the PPE? Yes. Okay, can you explain it to me? I'm busy. That's what you say. Oh. I'm busy, can you come back later? Okay. But if I am the nurse, and then the state would come to me, are you the nurse? ADON? And then it would say, can you explain to me the PPE? I would tell, sit down, I will explain it to you. Right? Okay, just remember the antonym. HR, Meg. HR, just remember the HR. HR department. So when they ask you, HR. Okay? When the state comes, HR, Meg, HR. Somebody comes in, what is the first? HR, Meg, Mom. What's that? Hand washing. Right? And then the R is robe or the gown. And then the mask. And then the Googles. Right? Googles. And the gloves. Did you have it? Okay, so you have not to wear. For example, this is the room. Right? This is the room. You don't go in and just wear there. You go in there outside. So you have to wait for the state. Come here. Come here. I'll show it to you. Okay. hand washing. How many seconds?
20 seconds.
To a whole new world. Just sing two. Okay. And then HR. Robe. And then mask. And then eye goggles. And then gloves. What did you go out? What's the first? GGG. GGG. Gloves. Gum. Goggles. Mask. Hand washing. Did you get it? Oh, you forgot to remove your gum. Actually, it's there. Good? Good. Is this important? Yes, ma'am. So if the patient is less than 60 years old, one symptom, exposed to a coronavirus country, do I have to bring him or her to the hospital? No. You would just tell him or her, stay at home. You are considered PUI. Okay, we are practicing the principle of equity and justice. What is that? When you bring this patient to the hospital, they will tell you, you are a nurse, you should know that. We are giving more exams to those who need it most. You don't need it. Good? That is the principle of justice and equity. Did you get it? Just like in the Philippines, they are giving more importance to the politicians. I don't know why. That's the reason why. COVID idiots. Idiots? I'm sorry. Help me, Lord. Are you with me? Okay, now, if I am more than 60 years old, that's me. I'm 62. Right? I'm 62 years old, so I am on the reading side. Am I right? I am 62 years old, so I am more than 60. Cool? And I have mild symptoms like fever or cough. Do I have to go to the hospital? Yes. Did you get it? Good? Okay. But us, do we have here? No. So are we exposed? No. We don't have visitors? No. Oh, where is the exposure comes from? Outside. Do you get me? Okay. So every time, me, I must be honest. I have lots of alcohol at home. Every time I come in from the door, close the door, remove all my clothes. I'm naked. So I walk at home naked. And then my husband will say, oh my God, she's naked. Yeah, that's true. Oh, yeah, right? Yeah. That's how it is. We are nurses. Okay? So that is coronavirus. Any question? 5, 4, 3, 2, 1. It attacks the B cells or T?
T cells.
Cytokines?
Cytokines.
It produces more virus?
Yes.
There's cytokine storm?
Yes.
Cause of death is? Inflammation. Okay. Is there a seeping out of the fluid?
Yes.
Can it cause pulmonary edema?
Yes.
Pulmonary fibrosis? Yes. Shortness of breath? Yes. Dry cough or wet? Dry because?
Because of
Cilia. Is it the goblet or the cilia?
cilia.
Very good. Question. Question. Nothing? Question. Or nothing? Okay. Anything. I know you have fears, promise. Kidding aside, I know you have fears. Just ask anything. Don't be ashamed.
I have a question.
Yes, ma'am.
If patient is positive with corona and after 14 days develop no symptoms, the person is not contagious anymore?
What?
After 14 days,
If
patient
she's
is
positive,
positive.
just remember this. The patient will not know that she is infected. She will not know. So if I am positive, I will not know. I'll talk to her, she will not know. It will only comes out after 14 days. But how will I know? I don't even know about it. As long as you're not exposed, as long as your immune system is okay, as long as you don't have the symptoms, you're good. Did you get it? If I have fever and I'm 62, I won't be here tomorrow. Why? I have fever. Did you get it? Because I'm 62. Will I be in the hospital? Hell no. Right? Why? I have to stay home. Right? I will just stay in my room. Eat everything I need. I need pain. So tomorrow, if you want to go, fever. I fever, I'm coughing. Okay? Cool? Any question? Any question? More question? No more questions, ma'am.
So if the patient who's already recovered from virus, is there any possibility?
No. It all depends. It all depends on your immune system. Because if you have the virus, you have the antibody. Now, just like AIDS, right? The AIDS is there. But if your immune system is okay, you'll be fine. The AIDS will not be full-blown AIDS. It's still HIV.
But it is still contagious?
Oh, for after 14 days? No more. Because the incubation period is 7 to 14. If the symptom is not there after 14 days, you're good as hell. You're okay. Okay?
So it will remain dormant then?
Yes. Memory cells? Are you with me? Right. Cool? Oh. Ano pa? What more? What is the difference between cancer and virus? Hey, cancer. Cancer killer. Okay? They're all the same. They're all the same. They destroy the cells, the normal cells, and it is being replaced by immature cells. Okay? So if I have cough, like productive, do you think that is also corona? That is a late symptoms. We have primary and secondary symptoms. Primary would always comes in the 3, right? Number 1 is fever, number 2 is dry cough, number 3 is shortness of breath. Okay, that is the red flag actually. And then the secondary, that is where the complication comes in. 2 of my brothers, because we were very poor before, they died of measles. It's not because of measles, but it's because of bronchopneumonia. 3 of them. You know what I mean? So it's today we have the vaccine, so we're good. You know what I mean? Okay. And my daughter has been breastfed for 2 years because I don't have any money to buy, you know, the milk. She has the immunity, she got it from me. Right? Yeah. And that's real. That's immunity. When you give the breast milk to your give the breast milk to your husband, to your right? After the baby comes that other baby, the bigger one. Right? Any more questions before Mom Glarina comes in? Okay. Okay. So this is how it is. So if you have any, just like in subacute, you have fever, right? Is that taxan, right? Yeah. So we already isolated taxan, right? Why? Is she positive? He's not positive. We are just like to monitor. So is he on PUM or PUI? I is like isolated. I came from India. I am 26 years old. I have no symptoms. I am cold. Very good. And virus attached to the and this can cause inflammation. Cause of that is stupidity. So when you report to the doctor, you seem very effective, very confident, right? Doctor, I guess the resident has corona symptoms. Why did you say that? Positive fever, dry cough, because it affects the cilia, you know. And the doctor would say, what cilia? You come over, I'll discuss it with you. And the doctor, okay, send out to the hospital. No sending out. Why? Just isolate, doctor. Isolate. Okay? More question? Okay, everybody was asking me, why is it ibuprofen is not given? Why Tylenol here, paracetamol in the Philippines? Yeah. Or guava. Leaves of guava you drink. That is in the Philippines. Oh, why not paracetamol? Why not ibuprofen? Yeah. Considering na siya ay non-steroidal anti-inflammatory. It's NSAID. But why is it not allowed?
Since the fever, patient has fever, right?
Right. Because if I have the inflammation, those are symptoms. You are masking the symptoms. So when I drink ibuprofen, I block the inflammation. The patient is already having aches and whatever, but there is no symptoms because you block it. Did you get it? Okay. Don't block the symptoms. Nobody knew about that. Did you get it? Just like when you have appendicitis. If you have appendicitis, you don't have to give pain medications. Why? You block off the pain. So they will not know that she has pain. It's already peritonitis, they don't even know. Cool? Okay.
Then the same thing if the patient has the urea and the plastic dip and then you give an Imodium.
Oh yeah. So you stop the Imodium no more. And then, doctor, she's still positive.
Because the patient still having the urea. Oh, because the patient is suppressing. Are you have to give it or you have to let it go all the take away?
Just take out the bacteria. And it's so funny because if the patient is seated, she was given antibiotic, and then after 14 days, you already check again the stool. Crazy. When you give the stool still positive, that's for life, man. So the patient will always be positive of seated, believe me. Then, question? You like these lectures? Right, you learn, huh? Next time, diabetes. Then next time, MI. Because you learn. Right?
Go with respiratory first. We're on the respiratory.
Respiratory one. Okay. I'm done. Respiratory. Oh yeah. My next topic will be respiratory system. Why? What's the difference between chronic bronchitis and emphysema? Chronic is big, emphysema is small. Asthma is young, emphysema is the oldest, bronchitis is, you know.
So the COPD is the oldest?
Yeah, COPD. No, COPD is consists of two. That is the bronchitis and the emphysema. If you talk about emphysema, what is affected is the alveoli. If you talk about bronchitis, what is affected is the bronchioles. Did you get it? Now, if they ask you, what's the difference between bronchitis and emphysema? Both of them are COPD. Okay. Bronchitis people are fat. Emphysema are small. They're thin. Bronchitis has, emphysema has pursed lip breathing. So they breathe. Okay? Bronchitis will, here. It comes from here. Here. Okay? So when you saw somebody who is big, bronchitis or emphysema? Bronchitis. Bronchitis is 50 to 60 years old. Emphysema is 60 to 80. Well,
The smoker is?
Smoker's cough is both. Wheezing is young. So if somebody would come to me, I'm 15, I'm wheezing, asthma. I'm 70, emphysema. God bless you. I'm 60, chronic, stop smoking. Right? I was a smoker for 30 years. Believe me. I smoke 2 packs a day. Every time I do my lectures, and mind you, it's ironic because I'm lecturing respiratory. This is COPD. Cut! Okay, break, smoking outside. And then I'm back. So every time I go up the stairs, and then when I came over here, I said, like, I need to stop. I did. My God, it's so crazy. Stopping smoking for 30 years. I have some psychiatric problem, like, I'm seeing somebody. You know? Yes, ma'am.
You're taking your CO2?
Yeah, that's what I really did, like, I wanted to, you know, I'm having like, yeah. What do you call that again? Huh? Withdrawal. I'm having withdrawal. Okay. And then the final test was, every time somebody smokes, I get close to them. I just want to see the you know, the discipline. And I'm good. Right? So far so good? Any question? Before I give the exam, huh? We have exam. Draw the pathophysio and explain. That's the reason why I asked you. If you have any question, right?
So you won't be scared anymore.
Yeah, you won't be scared anymore. So okay, this is it. It's not about the patho that matters. It's how you deal with the family, right? So with the family, why am I not allowed to visit? Sir, you came from outside. Your family is immunocompromised. When you come in, we don't even know whom you have been outside. That it's not for you, it's for him. How about the clothes? The clothes is also from outside. Let us do the laundry here. How about the foods? Same way. Anything from outside, not allowed. Did you get it? We all do it here. That is what you call the principle of that. So our mantra for today would be responsible, be smart, and of course the last is be kind. Did you have my point? Okay. We are frontliners. Sooner or later, Maling, there would be one here. Maling. I know. Who knows? We have to work together. Did you get that? If you have, I should have. If you die, we'll meet in heaven. Joke. Joke only. Because if you die, I should die first. And then I will tell God, oh, you came in so early. Oh, there is still a lot of nurses at the back. They're following me. Okay? So, no questions? Yes. No questions? What's that? Nothing? Did you understand the lecture? Did you understand the lecture? Okay, cool. Now you have the confidence of answering them. Right?